Hi, welcome to Pharmacology by Lecturio. We're going to continue our discovery of the autonomic nervous system and the drugs that we use to control various aspects of it. I'm Dr. Praveen Shukla. Let's start by taking a look at all of the direct activators of the cholinergic system. What we mentioned before in a previous lecture was that there were two types of cholinergic receptors, the muscarinic receptors and the nicotinic receptors. Now, in order to have activity at the muscarinic or nicotinic receptors, we sometimes use choline esters to activate them. Acetylcholine, methacholine, and carbachol will act at both muscarinic and cholinergic receptors. So these three drugs are drugs worth remembering, but remember that they are not necessarily specific between the two. The alkaloids, in particular pilocarpine, is a very specific muscarinic cholinergic agent. Obviously, muscarine, which is a chemical that we use sometimes, is a muscarinic agent, and nicotine, which is available in any cigarette that you want to smoke, is active at the nicotinic receptor, which is where they both got their names. So now we have acetylcholine in the synaptic cleft. There's one of two things that can happen with acetylcholine. The first thing is that it'll get broken down by acetylcholine esterases into choline and acetate. That's what we call metabolism of acetylcholine. The second thing that can happen is it'll actually act on the cholinereceptor. Now, if you activate acetylcholine esterase or give it a chance to work, the activity at the cholinereceptor is going to be reduced. So acetylcholine esterase stimulators will actually reduce the effect of that particular choline postsynaptic agent. Let's take a look at indirect activators. So edrophonium is a very short-acting acetylcholinesterase inhibitor. Organophosphates are intermediate acting, so they act for about 2 to 8 hours. Malathion, parathion are pesticides, and sarin is a terrorist drug, if you will, that was used in the 1995 Tokyo attack. So these are acetylcholine esterase inhibitors, which means that the amount of acetylcholine is increased in the synaptic cleft because you're inhibiting the breakdown. Carbamates are long-acting acetylcholinesterase inhibitors. They will act anywhere between 5 and 21 days. So there's neostigmine and physostigmine, and these are often used in the treatment of a disease called myasthenia gravis. We're going to talk about that in a later lecture.